Lauren. Hi, Andy. You know, we have deployed our Hitch Mobile stage today outside of this beautiful water wall at the Texas Medical Center. It's all hot, a little steamy, but it's a great day to honor our medical community.
It is a beautiful day. We are so honored, so happy, so proud to say that this is our second year at TMC, honoring the courageous healthcare workers who give a whole new meaning to the words dedication and commitment.
That's right, and today we have a very special story to tell you about. KPRC2 health reporter Haley Hernandez is going to share a little bit about her family's experiencing waiting for an organ donor.
You know, I could never have predicted this was going to happen last year when we were doing Healthcare Heroes, but I have a hero story of my own this year. I want to thank the heroes at UTMB for giving my dad a kidney. So we are actually just a couple months out. We are in the recovery phase of all of the phases of this journey. This is a new one now, and it brings its own challenges. But just so you know, I've been able to relate to you every step of the way during the pandemic, the tremendous stress that our families have been through, the long ER wait times. It's all been very hard. But for my dad, the alternative was to die. And a doctor at UTMB told me that patients on the transplant list die every year because there simply aren't enough donors.
Dr. Trina Ingebretson is a transplant surgeon, and by an incredible coincidence, she and her husband are also recipients.
You know, without the generosity of a donor, my entire family would not exist.
She says being a liver recipient helps her identify with her patients, and there are a lot of them. Currently nationwide, there's more than 106,000 people waiting for an organ. There's simply not enough. The easiest solution if you're a kidney patient is to have a living donor lined up.
The criteria to be a living donor are very strict, not just, you know, a history of some chronic conditions, but also anatomy. There are very specific anatomy criteria.
One recent option to move people off of the transplant list faster is to have them accept an organ infected with hepatitis C.
We can treat it with great success. Depending upon the drug use, 96 to 99% clearance of that virus post-transplant.
Of all the medical topics I covered, this is one I'm particularly knowledgeable about because at the end of March, my dad received a kidney here at UTMB.
I really wanted a kidney.
My dad, Anthony Hernandez, waited for a kidney for 7 years. We even made the trip to UTMB several times because we thought there was a match, only to be told it wasn't good enough. A disappointing blow as kidney disease continues to get worse with time.
No, you don't have a kidney. It's gone. And who knows when it'll happen again. And who knows whether you have the time left. I mean, my body was deteriorating.
Hi, Dad. Little did he know his day was coming. 2 months ago, he became one of the lucky ones to receive the greatest gift.
I thank that man every day since surgery.
This whole miracle of transplant is possible because of donor families and the decisions that they make in a very tragic time.
Now, what she's saying is that it is best to have that conversation with your family now before they have to make that decision during a tragic time. It also might not be enough to have it on your driver's license, so that is why you want to ultimately have that conversation before they have to make it in an untimely death. It's not a comfortable conversation, but it's one that should be had before you're in the hospital.
One of those tough conversations. So we saw that your dad got that kidney. Did he end up getting a kidney with hepatitis C?
Hepatitis C, and that could have been what helped us get one a little bit faster. Like I said, he's been on the transplant list for 7 years. He did get a hepatitis C kidney, and the virus did show up about 2 weeks after transplant, but he's being treated for it. And like she said, there's a 97% cure rate for hepatitis C. So we are so optimistic. We're in a really good place right now, and that's why I wanted to share that story today.
And he's doing great now?
He's doing good. Yeah. Hi, Dad. I know he's watching.
Your mom and the kiddos.
Hi,
out
Dad.
there. Thank you for sharing your story, Haley.
Thank you, guys.
We're so happy for him and for your family as well.
Thank you. We appreciate that. We